Imagine being drugged with powerful antipsychotic medications for over 2 decades, only to realize you may never have needed any of it at all. Today, we're diving into the story of Trudy, a remarkable member of our clinical team. As a teenager, Trudy was prescribed antidepressants for depression, and shortly afterwards, her condition dramatically worsened, leading to multiple psychiatric diagnoses and an increasing number of drugs. And these medications took their toll, draining her life force, wreaking havoc on her physical health, and making her give up on her dream of becoming a doctor. For years, Trudy's health declined, until 17 years after she was prescribed that first antidepressant, she developed a severe adverse reaction to a medication called protracted withdrawal. This experience made her start questioning everything, both her illness and the medications given to treat it. Through determination and an exploration of alternative non-drug approaches to her mental health, Trudy eventually found a way off these medications. Now 5 years free from all psychiatric drugs, she's healthier than ever and planning to return to medical school. How did she do it? Stay tuned to find out.
Trudy, welcome to the Taper Clinic studio. It's so great to be in person actually for the first time for our retreat. And I thought it would be an amazing opportunity to actually share your story in this studio setup. So thank you for being here.
Oh, thank you for having me. It's amazing to share space with you and be here together. I'm so excited.
Yeah. And so, for those of you who don't know, Trudy is one of our coaches at the Taper Clinic, and she has a remarkable story about recovery from like decades of mental illness using paleo diets, so dietary interventions. And so let's dive in right there. Maybe you could share a little bit. I mean, what was your mental health like before diet came onto the map for you?
Yeah, well, I had literally decades where I had struggled with my mental health. And, I had a bipolar diagnosis. I'd been given other diagnoses along the road of PTSD, dissociative identity disorder, not otherwise specified. I was on a lot of medications and not feeling well. So I was existing, surviving, not thriving would be the best way to put it.
When did all this start for you?
So I was a teenager, and, probably the easiest place is just jump when I started with psychiatry. So I was 19 when I was referred to a psychiatrist, and they put me on Zoloft, and within less than 6 weeks, I was suicidal and I was hospitalized for the first time.
Wow.
And so, in hindsight, I immediately had an adverse reaction to medication, but they didn't treat it that way. They put me on a mood stabilizer and antipsychotics and benzodiazepines and sleeping medication, and I came out of the hospital on 6 medications in 6 weeks.
Oh my God. And how long did this go on for? This carousel of different medications? Because it sounds like you get on when you're a teenager. Like, how long does this period last for?
So I would say acute period was 5 years where I was in and out of hospital a lot. I spent sometimes months at a time in hospital. I was on locked wards where I couldn't leave. I was actually held under a certificate where I was certified that I was a risk to myself. So I was not by law allowed to leave. And you basically lose all personal power. When 2 doctors sign off on saying you're stuck in the hospital, you're not safe to go anywhere.
Oh my God, that's terrible. And if you were to put yourself back in your shoes then, what did that feel like to you at that time? Cycling in and out of hospitals, held against your will. What's that mental space like?
I felt helpless, really. And I think I still had a belief in the mental health system at the time. So I believed that if I just kept trying different medications, surely one of them would help me. And I think because I had a lot of trauma in my childhood, that I was kind of just looking for a solution to be handed to me, for someone to fix me. And so I think in some ways I was maybe looking for caregiving as well, because I was still pretty young. And, I didn't encounter the caregiving. I just ended up 120 pounds heavier and
Wow.
very medicated.
Okay. And I mean, at that time, I know things are different now. I know you have a quite critical view of psychiatry, as do I. And that's why we work together. How did you understand the cause of your symptoms back then? You know, cycling in and out of the hospital, being on 5 different medications. Like, what was your understanding of what was happening to you?
I think my understanding was that they just hadn't found the right medication combo. So I literally bought back then, so this is in the 90s, and you could buy textbooks that had, you know, they were this thick and they listed all the different medications available. And I would spend time reading through those, just looking for medications I hadn't been on yet. Because they would regularly, you know, I'd spend 6 weeks on one medication, it wouldn't work, so they'd take me off and put me on something else. I was labeled treatment resistant. So they, you know, at one point, or more than one point, I had ECT. Mm-hmm. And, you know, I kind of just, my understanding was clearly what they're trying isn't working, but I just have to keep trying. There's got to be something out there.
And if you could mention, I mean, what were the diagnoses that were given while you were cycling through all of this?
Yeah, so I had rapid cycling bipolar 1 that was attached. I had dissociative identity disorder, not otherwise specified, PTSD, treatment-resistant depression. At one time, they never said I had borderline personality disorder, but they said I had borderline traits. And that really changed how I was actually treated. It led to a lot of mistreatment when I was inpatient because they see those words and they assume you're a behavior patient and they don't treat you very well when they think that.
Yeah, and I mean, for people who may not be familiar with that term, I mean, it's almost used in a pejorative way in the medical setting. I mean, it is like a label for someone who has unstable relationships and tends to be very dramatic. But I think when doctors often use it and healthcare professionals use it, they kind of, you know, borderline traits is this is a difficult person, you know, and you're going to have a lot of boundaries with them. So I could totally see how getting labeled in that way would, I mean, almost make people not believe you.
Exactly.
You know.
Yeah, it was like they didn't believe me. And so then I found myself in the place of having to advocate, you know, that like I really don't feel well, nothing is helping. And I think the label was given because they believed the medication should be helping me, and there was no way I should be feeling the way I was feeling with the medications I was on. And meanwhile, they weren't doing anything.
Yeah. Yeah, because I guess it's coming from a place where these meds work. They should be treating your rapid cycling bipolar and all of these things. And obviously, if they're not working, you have a personality problem. You know, there's less behavioral is where they come from, which is terrible, you know, just awful in so many ways.
Yeah, it's really denying the person's lived reality, and it's blaming the person for not responding rather than thinking maybe you're using the wrong treatment.
And, you know, sometimes what I've seen either from direct side effects from the medications, they can make people impulsive, they can make people irritable as well. But also when people are withdrawing from the medications, it can cause mood instability. And so, you know, someone may not be having the best day because of some drug-induced problem, but if the doctor doesn't see that, they're just going to say personality problem, something like that. And again, you know, not even looking at the drugs as potentially being a part of this. And in your case, I mean, if you're on like 5 or 6 different meds, the risk of having some mood instability from them is like, it's really high.
Yeah, and they were changing the medication constantly. So, because I wasn't feeling better. So it would be, here's this one, it doesn't help. So 6 weeks later, they'd stop it and they'd start another, and they'd bump, and they were always pushing me to the max dose because nothing ever worked. So their assumption was, if you're going to respond, you need the max dose. And I remember, you know, specifically with Effexor, when they tried me on it, they bumped me, I think, past the max dose. And that was the first time in hospital that I was like agitated. You know, I guess in hindsight, I have the language to describe it. I probably had akaphasia from it.
Yep.
But they labeled it as mania. Mm-hmm. And it was just viewed as proof of, oh, okay, you're bipolar. Mm-hmm. But they stopped it, and that agitation and inner drive, and it's almost an undescribable feeling when it's inside of you, and it's this ball of pressure that's just kind of churning, and you can't really do anything about it, but it's trying to burst out. And meanwhile, you're so sedated from antipsychotics and everything else that you also can't express it. Like, you can't move because you're so sedated.
Yep.
Yeah.
I mean, I'm thinking, like, this really is a classic story of what we call a prescribing cascade, right? Or I don't know, a diagnosis cascade, whatever we want to call it. Like, where you have someone who has trauma, or they're depressed because something's happened in their life. They have a side effect to one medication, then it causes symptoms. They get diagnosed with another thing. More drugs get stacked up on top of that, and then before you know it, your trauma has turned into treatment-resistant depression, and then you have a side effect to an antidepressant. Now you're rapid cycling bipolar, and now you're kind of irritable because they're swapping you around. Now you've got borderline traits, and I mean, we see this thing kind of stack up, and then, I mean, God forbid, some people have ECT, they get cognitive damage, and then people say, oh, well, this person has schizophrenia now because we're seeing flat affect. They're they're emotionless, they're withdrawing from people, and they've actually been hurt by the interventions, or they're over medicated, and so you get someone, trauma becomes this complex treatment-resistant psychiatric case.
Yeah, exactly. And I was actually severely injured by ECT. I have about 2 years worth of memory loss that
Wow.
It's never come back. And they just kept telling me, oh, it'll come back. It'll come back. Oh, nobody ever loses it for this long. And you'll still sometimes hear me, I'll think one word and a different word will come out. I have expressive dysphagia, and it only shows up if I'm really tired and haven't had enough sleep. I have to spend more time reading something than the average person to really understand it and bring it in, just because of the cognitive side of things. But my doctor has said I started out probably ahead of how other people understand things, and so he says the damage has kind of made me understand things on a similar level to how everybody else does, so it doesn't come across when you spoke to me, even though I have deficits, that I know that I see the world and move through the world differently now.
Yeah, I mean, I've heard people say that before, especially people who are really high functioning. When they get on the medications, they notice that they're not the same, but their doctors will say, oh, you're still pretty good. But it's like the person notices. I mean, like, things, like, I know this isn't me, this isn't the way my brain works, but everyone's almost, they're not validating that there has been a change to the person's experience.
Yeah. And it's one of the things I've thought about a lot in recent years was the time period I was on Zyprexa, and it was brand new at the time I was put on it. So the metabolic syndrome and hyperglycemia side effects weren't actually documented yet. And I gained 60 pounds in 6 weeks on it. And the crazy thing looking back is that I was gaining weight right from the start. By 3 weeks, I was begging my doctor to take me off of it. And I think the fact that I still kept taking it while I was saying to her, please take me off of it, really speaks to how much I still believed that I had to listen to whatever the doctor said. I had no power within myself to be like, well, is this helping me? What should I do to help myself wasn't even a thought in my mind at the time.
I mean, what it feels like to me when I hear that, it almost feels like an abusive relationship, when they're harming you, but you can't get away because they're so in your head. I mean, that's, I think, when you have the authority of a psychiatrist and a doctor, and I see a lot of people when they're having these problems, even their families go along, and the person's like, oh, I don't think this drug is helping me. But even the family member, because they have so much trust in the medical profession, will start to say, you really need to take this medication. And I think it bulldozes over someone's intuitive feeling that something is wrong with this, because you have all of these people just kind of dismissing it. And it does feel abusive.
Yeah. And it incredibly undermines your sense of knowing yourself, just your self-autonomy, your inner knowing. Like, we all have that inner sense within ourselves. And when you get kind of deep into the belly of psychiatry, you're completely disempowered. You're encouraged to not think for yourself, to not have any self-awareness, to only trust what the doctor tells you is real.
Yeah.
That was my experience anyways.
Yeah. And I mean, these aren't benign things as well, because I think about, and I've been involved in malpractice cases, actually for a young girl who was put on Zyprexa who developed a lot of stretch marks. And she has PTSD from the instance. She says when she looks at what, because she's lost the weight now, but when she looks at kind of the after effects of that weight gain, I mean, she just describes this just unbelievable pain and this sense of betrayal that, this person that was meant to help her, and now she feels like, she's got all these stretch marks everywhere. And I mean, that's substantial.
And you never get away from them. Like, I have upper arm stretch marks from my rapid weight gain, and they don't go away. Like, the bonds in the collagen were broken. So my skin can't shrink, even though I've lost weight. It can't shrink. And when my kids were little, if I would lift my arm up, they would kind of poke at it and say, "Mommy, why is your arm like this?" And so it's like this constant reminder, like, obviously it was innocent on their part. They're just children exploring their world, and they see this as different than what they've seen. But it's very, when your body carries the marks of what you've been through, you never escape that. It's always there when you get dressed, when you look in the mirror, when you are in front of someone else. So I have a lot of empathy, for what that person was going through.
Yeah. So let's segue now, because I want to ask, we've talked about cycling through a lot of different medications and being unwell. What did your life look like outside of your, being a psychiatric patient at the time? I mean, were you in school? What were relationships like? What was work like? What is the impact on someone's broader life as they're going through this?
Yeah, so at that time I was on disability.
Okay.
And I wasn't doing any work. And then kind of over, maybe kind of fast forward over the 5 to 10 years after my last hospitalization, where I was like, okay, I'm getting off of the medication roller coaster. I still don't feel good, but I'm going to try and figure out how to live like this, was kind of where I spent quite a long time. And so I managed to return to work, still dealing with regular side effects, not feeling good. I was developing cognitive issues. I thought in 2016, 2017, in that time period, I thought I had early onset dementia. Wow. Because my cognitive abilities were declining. I couldn't remember people's names. I had a constant tremor. I would randomly drop, like, I'd be eating dinner and my hand would just let go of a fork. So I had a workup done for early onset MS that came back negative.
How frightening. Yeah.
Yeah, so I felt like my body was just showing the signs of 20 years of medication and was starting to break down, was kind of how I felt at the time.
How old are you when all of this is happening?
So 2017, I would have been 41.
Okay.
Yeah.
Yeah. Wow. So just to kind of signpost things, you get on this as a teenager is when you enter the psychiatric world with the meds, and you're still on the meds at 41. Okay.
Yeah. And I had gotten off antipsychotics at that point, and the sleeping pills and the benzodiazepines I was already off of. But I was still on a mood stabilizer. I wasn't on an antidepressant, but I was on Strattera, which is marketed as an ADHD med, but it was originally tested as an antidepressant. And I was on Buspirone. So I was still on 3 medications, not as many as I had been, but I was still pretty heavily medicated at the time.
Yeah. So it's over 20 years you're on these medications. I mean, you've pared down a little bit, and you're working, but obviously not doing well if you think you're developing MS and early onset Alzheimer's at the time. What what changed for you? Because I know, I mean, eventually you come off all medications due to dietary changes. Can you tell me, I mean, where did the door sort of crack open and you started to think, hey, maybe there's another way without these meds? What was that process like?
Yeah, so it was actually kind of an interesting process because my cognitive confusion was so severe that I made a mistake when I was filling my dosette and cold turkeyed the Strattera accidentally and had a protracted injury from it. And so I think, as is pretty common, when you have a protracted injury, you start researching, trying to find everything you can possibly find to help feel better. And I came across a diet recommendation and I joined a program. And it was focused on paleo eating, basically it did had some Kundalini yoga that was part of it as well, and it had a community. But it was really the diet portion that shifted things for me. So I kind of went into it still having, serious brain fog, all of, the stuff that had come up with the protracted injury, and went into the program, started the diet, and was kind of tinkering in it a little bit because I knew part of the diet was going to be not eating gluten anymore. So I'd already been reducing gluten, and I'd noticed the days I didn't eat gluten, I felt a little better. And the days I ate gluten, the brain fog was stronger and I felt just more fuzzy and kind of out of it. So I kind of had some inkling of ideas that something's going on with diet and this might be a real game changer. But I was sure I certainly was not prepared for just how much of a game changer it was going to be, because I went into the program thinking, if it solves the symptoms I've been having, I'll be happy. But at the time, I actually still believed I was bipolar and I was going to have to stay on the Lamictal and the Buspar for the rest of my life. So it was when I changed my diet and all of a sudden my mind cleared and I went, okay, maybe there was nothing wrong with me. Maybe it was all food and I don't need the medication. And that was kind of really my aha moment was, here I am feeling better than I've ever felt on medication. Wow. Clearly the medication couldn't have been doing anything. So why should I keep taking it?
Yeah. And so how old are you when you start doing these dietary changes?
So that was October of 2017.
Okay, October 2017. How long after putting these interventions in place until you start noticing the changes? Is this how long did it take?
Less than 2 weeks.
Okay.
So I don't remember the exact date that the diet change happened. It was maybe around the 16th. And I had an appointment with my psychiatrist either the 26th or the 28th of October. And prior to 2017, my pattern had always been that I would go into a pretty significant depression in the fall. Okay. I would stick around for a few months. And so I would struggle all through the winter. And I went in and I'm sitting in my appointment and I looked at the calendar and I went, it's the end of October and I feel fine. And it was like just this light bulb moment because I was, I had recently changed doctors. And so I had planned to tell him this is a rough time of year for me, but blah, blah, blah. And instead it was like, holy cow, it's the end of October and I feel good.
Yeah. And so it sounds like you start feeling better and then was that very easy for you to start questioning the medications at that point? Did that just come naturally? Maybe I don't need to be on these meds, or was there any struggle?
Yeah, there was a little bit of fear.
Yeah.
And the program I was doing definitely had, take back your power component to it of yourself best and kind of act in that manner. And so I really took that to heart and I thought about it. And I decided, I'm feeling good. I know that if I stay on these medications, they'll shorten my lifespan. And I want to have a full life. So here I am. At the time I said to myself, I have nothing to lose. I'm feeling good. I'll taper slowly because I knew to taper slowly at that point. I need to see what I'm like without meds.
What was the journey off medications like for you?
It was really scary initially because when you've had experience with a protracted injury, you're pretty recovered from it, but you're going into a new taper. Your eyes are wide open, right? You know what can go wrong. And it makes you I felt really hesitant. You know, like, what if I go too fast? What if I become really symptomatic again? You know, what if I backtrack and the old symptoms come back? And so I moved really cautiously and slowly because of that fear. And I had a lot of people around me were saying, oh, you don't need to go this slow. Like, you're worrying about nothing. You know, I had a lot of people around me that were, I guess, doubting me. And I said, nope, I don't care if I'm going slower than I need to go. I would rather be safe than sorry.
Yeah.
And so it was 20 months that I spent tapering. And I had some definite bumpy patches, you know, times where I made a little bit too big of a decrease and I would have the edge of akathisia start and I'd be like, okay, not doing that again. And so I adjusted things as I went, and I had the experience at that point to understand that, you know, if I make too big of a decrease, I have higher levels of symptoms. And that was kind of the point I learned about microtapering, and I started experimenting myself with just decreasing by small amounts. And I read just a forum thread at one point that said people who've been on medications for a long period of time, their brain adapts to having all of these medications present. So sometimes they do better doing a joint microtaper. And I thought to myself, and it just kind of rang true to me. I thought, you know, yeah, I've been on these medications together for a long time. So maybe I should very carefully bring them down together. And that seemed to really help my taper. And it also shortened my overall taper because I ended up finishing both tapers at the same time. And so it wasn't without bumps, but I think, you know, from a taper perspective, it was uneventful. You know, I got through the rough parts. I took some time. I had a week of vacation at one point, and I had great plans to do housework and catch up on a bunch of things, and spent the week in bed, sleeping. And, you know, I wasn't very happy about that, but, you know, apparently my body needed the sleep.
Yeah. And so how long did that period last? You know, and you try the paleo diet, it's helping you, like, and then you start to taper. How long until you came off?
So it was I started tapering in November of 2017, and I finished my taper September 9th of 2019. Mm-hmm. And so it was like 20 months.
Okay.
September. 21 months, I guess.
Yeah. And this was Lamictal, right? And
yeah, Lamictal and Buspar.
Lamictal and Buspar, okay.
Were the last two.
Yeah.
Yeah.
How did your doctor feel about you coming off? I mean, you imagine you go to your doctor, you say, oh my God, I think I can come off. I think this was dietary. I'd like to do that. What was the reception like for that?
Surprisingly good. So I went into that appointment thinking I might be coming out of the appointment needing to find a new doctor. And I was prepared for that because my initial debate was, well, do I tell him or don't I? Like, do I just do it quietly behind the scenes? And I felt it was important to be transparent and have support. And so I went in and I said to him, you know, things are so different since changing my diet that I don't think I need these medications anymore, and I would like to slowly come off of them. And he said, okay, how can I support you? And I said to him, well, when symptoms come up, I need you to blame withdrawal and not relapse. And he said, okay, how long do you need me to do that for? And in my naivety at the time, I said 2 weeks. Yeah. You know, which I can laugh about in hindsight, but I'm really grateful for his response because I feel like I couldn't have asked for a better response.
It's the type of open-mindedness that we don't always see, unfortunately. I think many doctors out there are just saying, you know, they're of the understanding that, I mean, if you've been in the hospital maybe 5 times, you've had all this serious mental illness, you need to be on the medications for life, and that it's almost like a denial to come off, and that you're putting yourself in danger. I think that's the energy a lot of people get from their doctors when they want to taper, which is really unfortunate. Yeah.
Yeah, and he told me directly, he said, they teach us how to put people on the meds. They don't teach us how to take them off.
Wow.
And so when I said, I want to go slow, I don't care if it's slower than I need to go, he said, okay.
Mm-hmm. Well, okay, so you come off into 2019, and I think a lot of people think you sort of sail off into the sunset and everything is great off medications. But for many people, it's not like that, is it? It's kind of rebuilding your life, and some people live in fear, waiting for the other shoe to drop. I'm just going to end up in the hospital again without these meds. What was it like for you psychologically as you were kind of healing from this? Because, you've been on meds for over 20 years at this point. It's been a big part of your identity. What was it like leaving that behind?
It was scary. And the very interesting thing is that in December of 2019, I think it was, I had a gluten exposure on a work trip, and I didn't know that I'd had the gluten exposure. So I share this to illustrate how altered my thinking was as a result of this exposure, where I'd shared something with a friend through text message, and then somebody else texted me coincidentally asking about a similar thing. And my brain told me, this friend has been talking about me behind my back and sharing personal information to this other person. And it was like, it wasn't even like, there wasn't even the thought of, well, maybe it's just a coincidence. Like, this was the truth. My brain just wasn't thinking straight.
Wow.
So I'm legitimately laying on the bathroom floor crying. Mm-hmm. And my friend calls me, and she's like, have you had gluten?
Mm-hmm.
And I'm like, well, I did eat in the airport, and I ordered a salad that had bacon on it. It was probably fried in a shared deep fryer.
Yes.
And so that was when I learned, like, oh, I am really sensitive to gluten exposure. And it's interesting how quickly you lose coping skills when you're not having to use them, because that was the moment where I realized, holy cow, I used to manage these things in my brain all day, every day, of questioning, is the thing that I heard and the way I understand it the way it was meant? And it was this constant analysis that I was running. And so when gluten was removed from my diet, that constant thinking just vanished. Yeah. And so when I had the exposure, I didn't even recognize the abnormal thinking. And it was just stunning to me to realize, like, wow, I used to think this way all the time. Like, how exhausting.
Yeah. I mean, it does sound like, it sounds like borderline traits, that when you get exposed to something, irrational thoughts, some paranoia, emotional, like you're saying, crying on the ground, and people are like, what is going on with this person?
Yeah.
And it's just it's the impact that certain food sensitivities can have for people. Yeah.
Yeah, and it's incredible because there's actually some literature published about the effect of gluten-free diets on psychosis, first-time psychosis. And the literature isn't new, it's old. It was over 40 years old when I found it. And my first thought was, wow, why did my doctors not know this?
Yeah. And I know we see this now in our practice because we do have a patient that we're working with together. And it's a young woman who also was, I think, probably for nearly a decade, multiple medications, antipsychotics, ECT, clozapine, really sick, who changed her diet as well, and the whole thing went away, and we're tapering an antipsychotic now, which is incredible if you think about it. And I know there's hundreds of stories out there, and I think there's even, there are specific groups out there that are looking at not quite the paleo diet, but also the ketogenic diet out there, and there's just many people reporting these improvements, and I'm seeing them all over the place now.
Yeah, and I think the dietary intervention is often overlooked. And it's so incredibly powerful, because if you are one of those people who's reacting and you're having an autoimmune response in a way that is not typically recognized by medicine, because the brain types of autoimmune reactions, they're not picked up as often, right? Because how do you differentiate one kind of depression from a different kind of depression, one kind of irrational thought process from a different kind of irrational thought process? But I think, that trial, just taking it out and seeing what happens for a month, potentially it's life-changing.
Yeah, I mean, I wonder, having been on these medications for 20 years to learn that is dietary, how does that make you feel about the treatment that you received and the mental health system? When you look at what you've lost because of this.
Yeah, I've dealt with a lot of anger, and I won't claim that I'm done dealing with it, because it still comes up sometimes. I really candidly, I feel like I was robbed of my youth. I was robbed of, my dream as a teenager was to go to med school. And I'm obviously back on that path now, but there's been like 25, almost 30 years in the middle, right? Like, I could have graduated decades ago instead of being in the path of it right now. So I think it's an incredible loss, and it feels very preventable.
Yeah. Well, I never learnt about diet when I was in medical school or in psychiatry. It was always kind of presented as something that was not real medicine, kind of on the fringe, like it nothing like, the powerful medications that we use. And we were always almost taught to see mental illness as mostly biological and not medical or autoimmune. And I shudder to think at all of the people I started on medications in psychiatry training who came in with what I would now recognize as food problems, where maybe they had some irritable bowel symptoms going on, they had brain fog, they had depression and anxiety and irritability. Sometimes maybe they had some pain, lower back pain, joint pain, maybe some rashes, just all of these subtle things that end up getting split. Like instead of being seen as a cohesive whole, maybe coming from a food sensitivity, you see the psychiatrist for the mental health, you end up seeing the dermatologist for the rash, you see the GI person for a scope, for the gut stuff. And no one kind of puts it together with this, like, maybe there's an underlying etiology there. And that's how I operated for a long time, until I started seeing, well, actually, there's all of these things out there, diet included, that causes this pattern of dysfunction all over the body.
Yeah, and I think it's a root cause approach is kind of where I view the dietary intervention, is like, if there's something that's going into your body that your body is reacting to, it's medication is the equivalent of putting a Band-Aid over something that requires stitches or surgery. Might the Band-Aid temporarily do something? Maybe, but probably not.
Yeah.
But is the person who did it going to feel like they did something? Yeah, they'll feel like they did something. It just didn't solve the real problem.
To me, it's at the point where it seems like malpractice to not try a dietary intervention on anyone with psychiatric symptoms now. Because, as you know, we do this podcast and we're talking to a lot of people with horrible problems from the meds. And so, we talk to people who gained over 100 pounds from them. They've had changes to their body, people with tardive dyskinesia, which is permanent movement disorder that some people develop, and the people with protracted withdrawal, which sometimes goes on for several years. And all of these things can be avoided if you just don't start the meds in the first place. And there's so many people out there that if they do the diet, it may make them feel just good. I mean, it may make the biggest change in the world and it goes away, or it may just turn the volume down enough where you're able to cope better.
Yes.
So,
yeah, and I guess I consider myself practical in that I know a dietary change is a big ask for a lot of people. And so I understand that there are people that are going to say, nah, that's just too big of an ask. Give me the medication. I want to try that.
They don't know the risks, Trudy. If they really knew the risks,
right.
And that's why I think what we're doing here is so important, because I saw a statistic the other day. It said that 58% of people on antipsychotic medications were never told about the risk of tardive dyskinesia when they were started on the medication, which is crazy. If you think about it, it's in the warnings and precautions. It's a very well-recognized risk, and people just aren't hearing about these things.
Yeah, it's incredible, because I think back to when I was started on antipsychotics. I couldn't actually tell you if I was told of the risk. I know I knew of it fairly early on, but I was in the habit of reading labels.
Yeah.
And, I guess you can't underestimate the power when a doctor says, this is your only option. Yeah, there's side effects, but it's the only thing we can do to help you.
Yeah.
And so you're kind of, believe it or not, there was a time where I was signing an X for my name because I had such severe tremors from the antipsychotics that I couldn't actually even print or sign my name. And even the X, I found a document years ago that had an X on it, and the X was squiggly.
Wow.
Like I couldn't make even a short straight line. And I had a tremor even after I was off of antipsychotics. I thought the tremor was permanent. I thought it was just mild tardive dyskinesia because it doesn't always go away, right? I got lucky that it must have been being sustained by the Lamictal.
Yep.
Because after I finished the taper, I'm steady now.
Yep.
I don't have any tremors.
And some people with TD, they do improve as well. It's not like so the Lamictal could be a role, just the healing of the brain. I tell people, no matter what situation you're in with the medications, that there's a lot of neuroplasticity going on, and we see people with protracted withdrawal make these tremendous recoveries, and there is, and so that's lucky. Yeah, it's like the one lucky thing that's happened. Yeah. So,
yeah, it's great. And I used to always tell myself when I was kind of in the middle of the tapering, I told myself repeatedly that this is, my neuroplasticity is how my brain is going to heal. I would just regularly remind myself, I am going to heal. My brain has neuroplasticity. Everybody's brain can heal. And I really held on tight to that when I was tapering, because I so badly needed to believe that when I finished, everything was going to be okay. And I think there's something to be said for the power of expectations. And I think it's so important to have that hope that surrounds someone who's in the process. And I think it's one of the most powerful things that we provide to the patients that we work with at Taper Clinic is that hope and reassurance and that vision of, yes, you're going to heal. This is the path that everybody is on.
So Trudy, I want to segue now and just talk about how your life has changed since implementing diet and coming off medications. I just think this is important because I know at times you've said to me you wouldn't have believed that you would be living the life that you are now. So how have things changed since all of this has happened?
Yeah, that's a great question. And you're right, I've said that to you probably multiple times. I have a life of joy and consistency. I wake up each day having a pretty good idea of what to expect. I don't look at the calendar and question what's my mood going to do. My actual calendar on my phone is booked full of things. And if you had told me back in even 2019 that I would be okay having a full calendar, I would have said, no way, you don't know me. Because I didn't like to commit to things. I was afraid to have things on my calendar because there was so much uncertainty day to day that I felt I couldn't commit until, half an hour before I was supposed to leave, and I would know if I was feeling up to doing something. And the times when there was unavoidable commitments, I would feel huge anxiety and stress and worry, like it was this lead weight sitting on my calendar, this thing that I had to do. And now my days are full, sometimes weeks ahead of time, and I don't care. It's like, it's okay. And, I'm very non-reactive to things now. I would say, like, when something upsetting happens, I can take it in stride and I can say, okay, well, here's what we can do about it. I'm a problem solver, whereas I used to be much more like just hoped someone else would take care of it. And I move through life with a whole lot more purpose and proactively. I dream, I have goals, and I have self-confidence that I really never developed in all the years on meds.
Mm-hmm. Yeah. And I know you sort of snuck it in earlier on, but Trudy is planning on getting to medical school now. And we're going to put that out into the universe, and it seems inevitable to me because you're such an amazing coach at the clinic. And so, I just can't wait to see all of that happen.
I'm super excited for it.
Yeah.
And I'm, it's a big goal with lots of hurdles to go over, but I have the confidence that I can do it. And I really want to use my experience to support other people. I want to be that evidence-based doctor who also knows how to listen to the patient and recognize when you're hearing something that is maybe not inside the box that you were taught, to think outside the box and trust the patient first and foremost. Because I strongly believe that each of us as individuals, we know our bodies best. We're living in our bodies. And I've encountered so many times where people have told me, no, that's not what's going on. Here's what's going on. And so I want to be the doctor that listens and responds appropriately. And I'm really looking forward to that journey. I know it'll be a challenging, long one, but I'm up for it.
Yeah. And why else are you alive if not to follow your dreams? And so I think go for it. Yeah. Yeah.
You only live once, right?
Yeah. Yeah. So, Trudy, it's a great place to end. Thank you for coming on and sharing your story.
Yeah. Thank you so much for having me.
Yeah.
If you're interested in learning about why dietary interventions can dramatically improve people's mental health, you're not going to want to miss this interview with the carnivore shrink, Dr. Rachel Brown.